We are here today for another monthly education session with Deena Stewart, nurse navigator for gastroenterology, and we are talking about Crohn's and colitis awareness. Crohn's and colitis awareness is the first week of December, and both of those conditions are known as inflammatory bowel disease, correct, Deena?
Yes, that's
so
correct.
tell our viewers, what is inflammatory bowel disease?
Well, inflammatory bowel disease is a chronic condition, and as you said, it includes Crohn's disease and ulcerative colitis. And this is a condition that's thought to be autoimmune. We're not really sure what the cause of it is, but in both conditions, inflammation occurs in the lining of the GI tract, and long-term inflammation can lead to ulceration, damage, and an increased risk of cancer in the GI tract as well. Well, with Crohn's disease, which is one of the types of IBD, it can affect anywhere from the mouth, esophagus, stomach, the small intestine, which there's about 20 feet of that, and then the colon all the way down to the rectum as well. So any part in the GI tract. And then with ulcerative colitis, it only affects the colon or the large intestine.
So I know people may ask, is inflammatory bowel disease the same as irritable bowel?
Well, that's a good question, and that gets mistaken a lot from one for the other. Irritable bowel is a syndrome, and inflammatory bowel is a disease. So they are quite different. They may have some similar symptoms like abdominal pain or diarrhea, but with irritable bowel, damage isn't being done to your GI tract. With inflammatory bowel, it is. So IBD is much more serious. And with IBD, you might have additional symptoms like fatigue, weight loss, anemia, rectal bleeding. So that's the difference.
Okay. Who may be affected by inflammatory bowel disease?
Well, really anyone can be, from infants to adults in their later years. The most common age group is 15 to 40. We see it a lot in teenagers in high school, and then we see groups of people that are diagnosed in their 60s or later. So there are more than 3 million Americans that are affected with IBD.
Oh, wow. So if they are experiencing symptoms of IBD, what should they do, or what's your recommendation?
Well, you should always talk to your primary care provider first, and then you should really, especially if you're having rectal bleeding, anemia, fatigue, and those symptoms, because those can be also symptoms of colon cancer, you should be referred to a gastroenterologist right away. But a lot of people don't need a referral. You could just go to a gastroenterologist yourself, so that would be the best thing to do.
Okay. Well, thank you so much for your time and for being here with us today. And that concludes our video topic for today in awareness for Crohn's and colitis this week in the month of December. Thank you.
Thank you.